Hello, I'm Dr. Stephen Berger. The purpose of this video is to explain to you the potential risks of your cataract surgery. While cataract surgery is generally safe and successful, real complications that can impact your eyesight and your quality of life do occur. And part of planning for your surgery is to communicate these risks to you and ensure that you fully understand them. Although rare, one of the most serious complications of cataract surgery is infection inside of your eye, which can produce blindness. The incidence of this is roughly 1 in 1,000, but since it does happen rarely despite all efforts to prevent it, it's important that you be aware of this. Bleeding inside the eye, damage to the eye from the anesthetic that is used to numb your eye, and detachment of the retina, the rear portion of your eye that transmits vision to your brain, can also produce a permanent complication. Additionally, damage to the optic nerve can reduce your eyesight permanently. Swelling of your eye, either of the front cornea or the central portion of the retina, which we call the macula, can also decrease your vision following cataract surgery. While the vast majority of these resolve on their own and with the use of eye drops after surgery, it is possible that this can be permanent. In rare cases, this may even result in the need for additional surgery, such as a corneal transplant to replace a swollen cornea. Macula or retinal swelling can also impair vision and can only be treated with medications. It too can be permanent. Your cataract will be removed using ultrasound. This is a technique in which a small probe is inserted into the cataract to fragment it, dissolve it, and vacuum it out of your eye. If a fragment cannot be fully and safely removed, or it dislocates into the rear portion of your eye during surgery, it is possible that you may need additional surgery to remove the fragment. In some cases, this can reduce your eyesight permanently after surgery. About 25% of patients undergoing cataract surgery will eventually require an office laser procedure to remove haze on the thin membrane which is left behind during your surgery. This laser, called a YAG laser, is a simple in-office procedure that is generally well tolerated. The risks of the laser itself will be reviewed with you separately should you need this procedure later on. Since most patients have a local anesthetic used to numb their eye for cataract surgery, it is possible that you may experience bruising and swelling from the injection site. This generally resolves on its own. Rarely, however, patients can experience long-term droopiness of the upper eyelid or even double vision. Additional surgery might be required to address these problems. An intraocular lens implant, or IOL, will be placed in your eye following removal of your cataract. This is done to allow your eye to focus again, since the cloudy human lens will be removed. While most cases have the IOL placed behind the pupil, a posterior chamber IOL, in some cases where the back membrane of the cataract is not intact following your surgery, an IOL may be placed in front of your pupil, an anterior chamber implant. Removal of some of the vitreous gel from behind your cataract may also be required if this membrane is no longer intact. These type of more challenging cases can be associated with a higher risk of vision problems due to retinal swelling, inflammation, or a higher risk of retinal tear or detachment. It is possible that the power of the implant may be off despite best efforts to calculate it before surgery. In rare cases, this may require that the implant actually be removed and replaced. Rarely, an IOL may not be placed at all if your surgical conditions are challenging enough that it cannot be safely positioned. Also, some patients may experience a dark shadow peripherally or other light disturbances such as glare. These generally improve with time, but in rare cases may actually require replacement of the implant. Chronic inflammation of the eye from the IOL is also very rare, but it is possible and may require the prolonged use of eye drops or rarely replacement or removal of the implant. As a result of your cataract surgery, your intraocular eye pressure may be elevated. While this is generally very temporary, it is possible that an elevated pressure can lead to swelling of your cornea or damage to the optic nerve inside your eye. While the appearance of your eye is generally quite normal after surgery, it is possible that your pupil may not be round, or that your iris, the colored portion of your eye, may atrophy or thin out as a result of the surgery. This can produce an altered appearance to your eye or increased light sensitivity. Most cataract surgeries are completed without the need for stitches. However, it may be advisable to use stitches for your own safety in certain cases. It is possible that your incision could leak after surgery and need separate surgical repair if it does not seal on its own. Astigmatism is a common condition that can reduce natural vision. To help you understand astigmatism, we've used the analogy of sports. A round basketball would have no astigmatism, but an oval football would have lots of astigmatism. As a result of your surgery, astigmatism may increase and require additional treatment, including glasses, astigmatism surgery, or contact lenses. Pain following your cataract surgery is generally mild and temporary. This generally improves in almost all cases. However, chronic pain or foreign body sensation can occur infrequently and can be long-term. Of course, like any surgery, there may be unanticipated complications that can't be predicted. This video describes the most common and serious of the known complications of cataract surgery, but it is not intended to include every possible adverse effect that may occur. If there are specific complications that can be predicted before surgery after your eye is examined, these will be discussed with you specifically at the time of your eye examination. If any of the mentioned risks are not fully clear to you, or you simply desire more information about them, please speak to our surgical counselor or Dr. Stephen Berger, and we'll address any and all of your questions. Knowing that you fully understand the risks of surgery is very important to us, and we endeavor to make sure this is as clear as possible before you have your procedure. Following this video, we will ask you to sign a form indicating you viewed the video and that you understand the issues discussed. In addition, our surgical counselor will review these potential complications with you and have you sign the written surgical consent form. Thanks for watching, and we really wish you all the best for your procedure.